My name is Blankenhorn. I'm an orthopedic surgeon who specializes in foot and ankle surgery, and I'm an assistant professor through Brown University. People don't realize how important their feet are until they have a problem with them. So you can make a very impactful change in someone's life by helping them if they have a problem with their foot or their ankle. I treat patients from adolescents to senior citizens, all of which could have traumas such as fractures, deformities like bunions, or arthritis from previous traumas. I treat all of those conditions as well as athletic injuries. My goals for providing for my patients are to try to give them the best care I possibly can, understanding that I cannot solve all their problems, but hopefully trying to support them through whatever process they're going through to try to make them better. Foot and ankle surgery is a very difficult thing to go through, and I try to provide for them the right expectations as far as what their recovery will be like and what their overall outcome could be. One of the most rewarding parts of my job is educating other orthopedic surgeons. So teaching residents about the foot and ankle, helping them on their career paths, developing their own careers, some of which go into foot and ankle surgery. We also teach at the level of a fellowship, which is somebody who's graduated from an orthopedic residency who's specializing in foot and ankle surgery. So teaching at all those levels is very rewarding. When I'm away from work, my wife and I are both competitive swimmers, so we're able to participate in a lot of open water swims throughout Rhode Island, which has been very rewarding since we've been back. We also have 2 young children we spend a lot of time taking care of as well. The most rewarding part of my job is when a patient's gone through a long recovery and has finally reached the end of their process and are happy with their outcome and pleased that they did their surgery and improved their life in a manner that they're satisfied with.